Hey Cam followers, it is lovely to be here with the wonderful Dr. Narda Robinson, who is going to be talking to us today about something very, very important that a lot of people overlook. It is everything that's happening in and around the joint. People become very focused about arthritis, just about the joint, but there is a lot more going on. So please stay tuned. I'm going to let her introduce herself in a minute, but first of all, I just want to quickly tell you all about the Big Walk. So the Big Walk is running again this year. It launches on September the 1st. And as soon as it is launched, you cannot sign up thereafter. So you have to make decisions now. It is a mere £10. It is a virtual walk. That means that you don't actually need to do any walking. It's all about education. It's about us helping you better understand the disease and all the things that you can do to better manage it. It's turning into quite a big thing. We were just laughing about it. Curacore is our gold sponsor, which is really cool. This is Dr. Narda Robinson's school. And we just really want to try and get people thinking about osteoarthritis in a different way, a lot earlier in the dog's life, so that we can really, really attack it. Now, as I said, the Big Walk is virtual. You do not need to attend, but the little walks is for you guys that actually want to do a little sponsored walk yourself. So if there are people out there saying, hey, I want to kind of meet up with some friends, I'm going to raise some money for Cam, the Little Walks exists, and there is a brilliant PDF pack on the website for you to print off, sponsor forms, badges, everything. So you can do that. But if you just want to attend, it is going to be incredible. There's competition prizes, there's bingo, there's tips from the expert, there's soundbite from the expert, there's Hannah's hacks, there's insights into the vet practice, you name it, it's in there. So I'll do all that again at the end. Right, Mrs. Tell everybody how amazing you are.
Oh, well, I'll tell you my background. I am an osteopathic physician in the U.S., so licensed same as MDs, but we also practice manual therapy and have a more integrative approach, so whole person, that I brought to veterinary medicine when I became a veterinarian years later, but now back in 1997. And during that time, as I was graduating, I still had and still have my human practice available. So I was treating many of the faculty and administrators at the school where I then taught for 20 years, so Colorado State University. So when I said, if these patients that are in this vet teaching hospital, if they were my human patients, then we'd have a lot of options for them that aren't just drugs and surgery. So medical acupuncture, soft tissue manual therapy. Nowadays, we also incorporate laser therapy. And then with Curacore, we're also teaching integrative rehabilitation. So it's rehabilitation plus all these integrative therapies that forms the complete whole. So I stayed at CSU, created the medical acupuncture for veterinarians course, and 20 years later, I thought, well, I want to also start some courses for my human colleagues. And so now I'm accruing cases. We videotape humans that I treat, and then we'll compile that into a human version of the medical acupuncture for veterinarians course. So lots to do. Yeah.
You're busy.
I am, yeah. And but there are so many options for people that need to know about these non-surgical, non-drug things. You can combine it with drugs, and oftentimes that's important, but we don't have to rush into surgery as much as many people believe. So I'd like to expand the opportunities for taking some time, giving that animal a chance before we go start changing their anatomy, and with the TPLO, for example, reformatting the architecture of the knee in the dog.
Okay. Yeah, so we've got a lot to cover today.
Yeah.
So everybody that's here, please do these lovely shout outs. It's great to hear that there's people listening from New Zealand. We've got Michelle Stebbing from New Zealand. We've got my lovely Alison, who's just down the road in Bude from me. So please say where you're listening from, because it's lovely to know that we're actually reaching the wide world out there. Right, now let's crack on. So first of all, I think we really need to explain why we're going to talk about soft tissue. Soft tissue being muscles, fascia, tendons, ligaments. Why? Because most people go, but arthritis is about the joint. Explain, please.
Yeah, no, arthritis is about the whole being. I mean, there's the metabolic aspect. So we're not all the same, nor are our animal companions. Some have more of a pro-inflammatory state than others. Part of that is perhaps genetic, but there's also dietary factors and just lifestyle factors that may encourage like the expression of an inflammatory kind of profile, versus if you're doing things that are more health promoting, then that helps keep everything into balance. And yeah, we talk about, I have my little dog here. Um, we talk about the joint with osteoarthritis, but really, if you look at the multiple tissues, they contribute to the development of osteoarthritis. So that's one thing. The other thing that I'd like to have some time for discussion is the chronology of it. So, especially from my osteopathic medical background, I like to think, okay, when I'm talking to a patient, whatever species, when were you normal? And how did this develop? And what were the inciting factors? And if we think even about our own body and where we might have some arthritis or something's going on, I mean, it just doesn't happen from one day to the next. There's a course where, okay, yeah, my knee always gives me trouble. Oh, now it's getting stiffer. Okay, now you know that there's a developmental process along there. And so from a preventive medicine perspective, I advocate for finding problems early. So even in animals under a year old, what we can find are areas of myofascial restriction. So in the muscles and the tendons, in the fascia that start to shorten. And that, when it's around the joint or the back, neck, whatever, that's going to alter the mechanics of the joint and movement. And there's a whole sequence of problems that arise from there. So
I think it's like a chicken and egg thing, isn't it? So when people go, what came first, chicken or the egg? And I think the OA is very similar. You can get the arthritic change leading to soft tissue changes, and you can have soft tissue changes that are leading to different joint biomechanics, which we could argue lead to focal areas of stress within that joint that degrades the cartilage and leads to the osteoarthritic process. So, both directions, soft tissue is hugely involved, isn't it?
well, it is. But again, we don't just wake up one morning and have bony changes in our joint, nor do the dogs. So there was a period where it was normal. Usually it came out, you were born, it was sort of at least normal, barring birth defects or whatever. And then there was maybe wear and tear. Yes, maybe there is as I said, a genetic predisposition, but it's not going to be just random joints usually. It's going to usually be areas that have some kind of weakness. Now, yeah, okay, some dogs, some breeds might have more of a chance of having hip osteoarthritis. But where were they before that? And how might we intervene with physical medicine measures so that it limits it or prevents it, and they remain strong, and even if it develops, that their tissues are robust enough to keep them active, and you know and the nervous system in a good space. So if we take hips, for example, what I see and what I teach about is that even when a dog comes in, what we're going to do is myofascial palpation. So I've shown this on a lot of other videos, but we have our hands on the tissue and it's not scary. I say make it feel like a massage. And we're just coming in a cross fiber direction and we're feeling for ropey bands where there's shortening and tightness. And you can watch the animal and they'll kind of give you a look, or their respiration will change, something like that. And so that gives us information about their history and their changes in weight bearing. And I know you know this because you do massage and stuff too. But it's not that there's just a tight muscle and that's, oh, well, that just happened out of the blue. It's like, oh, why is that muscle tender and tense? And then when we follow that, we'll usually see it in patterns. So it's not usually one muscle in isolation, but rather what we call a strain pattern. And that is like a recording in the body of what's been happening in their life and how they've maybe compensated or just off-weighted, or they've just, like it's like with us, if our shoulders get really tense, if we tend to have migraines, that could go up into our neck and into our head and produce a headache, produce a migraine. So things will start off, and then these patterns, just it doesn't take much over time to incite that, oh God, okay, I know now I'm going to have this problem until I get a massage or do whatever, stretch, all these things. With the hip problems, what I see whatever, over and over again, is that when we're palpating the inner aspect of the pelvic limb, that the gracilis muscle, the pectineus, these medial muscles on the inside tend to be tight. So if we're like, well, this dog has a pelvic limb lameness, we're palpating. If I notice that, then I'm not as concerned about the stifle or the knee. I'm more concerned about the hip, because back to the soft tissue and your question, yes, when the hip starts to go awry, what's an inciting factor for that arthritis piece? Well, the ligaments are loose. There's ligamentous laxity. There's also probably some atrophy or some non-firing of those muscles around the hip. So we're going to have too much movement in that hip joint. What's the natural reaction from the body to keep that limbs more stable? These inner muscles are going to fire. And so it's about just educating people and veterinarians and all that. What can we find with our hands that will give us information way, way sooner than we have a lot of joint deformity?
Yeah, I think that's like, so I'm quite lucky because I didn't really discover the integrative approach till a lot later in my career. So I'd already been a vet for 10 years by that point. And I was taught arthritis in a very pharmaceutical, surgical, standardized approach. And never really thought about muscles and ligaments and tendons and their role. Very focused on joint, cartilage, the joints. So I ended up doing a course that kind of highlighted how important the soft tissues around said joints and elsewhere in the body are. And that, as you say, you can use them to help with diagnosis, but you're also treating them to alleviate discomfort and use the limbs, rest of the body appropriately. So let's kind of explore that just a little bit. Let's start with, as you've been doing, using it as a diagnostic tool. And I'm just gonna say this because for me it was mind blowing. Bear in mind I've been a vet for 10 years. Palpating just behind the ears as a dog comes into the consult room and feeling tension and going, there's a problem. And when people, so the vet's talking to you, you've come in vomiting and diarrhea, you've got a tooth problem, there's something else, and you palpate behind the ears, and you're like, and you've got musculoskeletal issues going on, and you're like, oh, I can't talk about it now because you've come in for something else. But developing that skill over the last 10 years has just been mind-blowing for me. So yes, using the soft tissue to diagnose that there's underlying problems. And as you say, there's certain patterns that you can follow that give you a hint of where a primary source would be. Now, what about treating them? So using the soft tissue to alleviate pain and discomfort and hopefully making them more mobile, more functioning better, less vulnerable. Talk about that a little bit.
Yeah. Oh, great. Yeah. And one of the things that has become apparent probably over the past 5 years is that because we approach integrative medicine from a strictly scientific perspective, I like to teach and work from the idea that we understand the mechanisms of disease, so the pathophysiology of the problem, whether it's soft tissue, bony, arthrodial, so joint, or spinal cord injury. So what's the acute and chronic change in the physiology that's going on that we can match with medical acupuncture, medical massage, photomedicine, which is laser and light emitting diodes, herbal medicine, and therapeutic exercise to an extent. and as well as pharmaceuticals if we wanted to go that way. But there's so many options that are even better than drugs and surgery. For example, with spinal cord injury, very clear that we could talk about at some point. But um, anyways, just to improve the health and the functional connectivity of the nervous system. So from a soft tissue perspective, again, just one thing that we didn't quite talk about was the role of the nervous system in inflammation and pain. So I always have a big question. We talk about osteoarthritis, but and I don't feel like I have any arthritis here. I'll get myofascial restriction, but I don't know of myself having any arthritis, but I have a knee that goes out if my muscles aren't working correctly and if I'm not exercising enough. So if I didn't correct that, I think I would predispose to arthritis. But it's the nervous system that will send out these pro-inflammatory, so inflammation-inducing chemicals that then affect the joint and change just that environment and incite that osteoarthritis development. So even with rehab and soft tissue techniques, the nervous system plays such a central role because it is the signaling overseer of how we move and how we're going to protect ourselves. And so if you have an arthritic joint, let's say this dog had an elbow problem, there would be some bony changes, deformation. There would be sensitivity there. Well, what's that sensitivity from? That's the nervous system being irritated and inflamed. What else is going on? Well, there's a lot of myofascial restriction. If you feel around that elbow, it might be more on the lateral side. It might be more on the medial side. It depends on what's going on, where the joint changes are, and how the animal is changing, walking, what kind of past injuries are affecting it, all that stuff. But if we're going to use an integrative medicine and rehab approach, we need to palpate that and determine, is this more biceps restriction? Is it triceps restriction? Does it go all the way up to the neck and head and all that? If then we want to talk about treatment, then let's take acupuncture, for example. How would we approach this? Well, adding in electroacupuncture as well, that once we decide where the problem is and what facets of the osteoarthritis we want to get at, but really this whole body pain, we can choose needles, choose points around the elbow and carefully and painlessly insert needles there. What's that going to do? It's going to release some of that fascial restriction that is not only the superficial fascia, but the fascia, like the covering, the connective tissue that surrounds everything and envelops it, goes between the muscle fibers. Then that is what is part of the restriction in range of motion. So yes, there can be joint changes, but when we're talking about changes in function, so the structure changes, then how does that affect the function? A lot of that is from this soft tissue restriction. So how can we change that? Acupuncture going in locally can help to relieve that fascial tension. It also helps to relax muscles, and so does massage, and so does, to an extent, photomedicine, so laser therapy, and other things as well. So if we break it down, what's the osteoarthritis? Okay, there's nerve problem, there's nerve irritation and inflammation that's local, but it's also coming up that peripheral nerve and into those spinal segments that are part of where that nerve comes from. So we can help reduce irritability, so reduce windup in those nerves peripherally and centrally. That's going to calm down the nervous system. That's going to reduce inflammation because that nervous system, those nerves aren't so unhappy anymore. And with that too, then those nerves can better send signals. So think of the old dogs that are just walking like this, and they're having so much trouble balancing, and they have pain, and they're just struggling, and hopefully nobody is pulling them along with a leash in back of a bike. Anyway, that's a pet peeve of mine. But anyway, so there, when there is pain in a joint, from various tissues and all that, there's something called arthrogenic muscle inhibition. And this is big in the rehab world, but we should all really know about it. So what arthrogenic is coming from the joint, and there is pain in the joint, And that through a series of reflexes throughout the nervous system and changes in muscle firing, that's going to inhibit those muscles from being strong enough to stabilize the joint. It's a key factor in treatment. So maybe we use medication, maybe we use some kind of herbal therapy locally, systematically, maybe we use the laser, and acupuncture and massage, things that will reduce swelling in that region and reduce the fascial restriction, because what's going to help that dysfunctional joint? It's going to be good tone in the muscles with strength, with flexibility, because that's what the joint is about. The joint is just a place.
I think that would be good
right?
to kind of like recap that so that people kind of understand, because we're like jumping around and they're like, whoa, what's going on? So think about it, guys. You've got a joint and you've got the cartilage surfaces with joint fluid in between, and those surfaces are hopefully kind of quite well matched, so you get some stability. That's called static stability. And then you've got your joint capsule, which is really fibrous, and that's got a joint lining in it that produces that lovely joint fluid. And then surrounding the joint capsule and actually all merging in because of fascia, you've got your muscles that move the joint. So you've got antagonistic pairs of muscles so that you can flex and extend a joint. They work brilliantly coordinated together to make all of this happen. And you've got tendons running from distant from the muscle going into a tendon, going all the way down to the little digit like here. You've got all of this is coated in what Narda keeps talking about, fascia. And I always say to my owners, when you have a pork chop and you pull the meat away from the bone and there's that spider webby stuff, that's fascia. And they're like, right. And I was of the generation that when at vet school we did dissection, they said, pull all the white stuff away, get it out of the way so that you can see the important stuff. And actually in the last 20 years, we've gone, oh my God, it is the important stuff, because fascia, this spider web, this cling film, coats everything from the little muscle fiber, every nerve, every organ. And if you were to get rid of all the other tissue, so if you had put me in a vat of something that pulverized everything bar fascia, and then you lifted me out again, I'd still have my full shape, because fascia weaves into everything. And I was told it is the third communication pathway, system. And I was like, huh? So you got your blood system carrying your hormones. So you got your nervous system with the electrical impulses, and you got your fascial system that spreads information by movement and changes in tension and stuff. And fascia allows you to know that that finger is above the head. It's so clever. It's very, very well innovated. So it's got a huge amount of receptors in it, taking information to the brain. So fascia, but fascia is a little bit, it gets upset easily, doesn't it? He doesn't like to be messed around, does our fascia. And if we don't use it appropriately, it becomes really quite sticky, and it doesn't have the same flexibility. The flexibility starts to go, it clamps down and it shortens, doesn't it? So what Narda is kind of like talking about is that when we think about arthritis, we tend to only think about the joint, but we actually have to consider the whole joint, up the limb from the joint, the rest of the joints within that limb's role in the whole body. So if I had a painful knee and I'm offloading that side's going to get weaker. And if it's not moving as much, it's going to get restricted. And the other side that's carrying more weight is going to start to compensate, and it can cope with it for a while, but then over time that starts creating problems, and I get a twist in my spine, and my neck's going one way, my lower spine's going the other way, and then I suddenly I start getting pain not near my knee. I get pain in my neck and my lower back and stuff. And that's what we're trying to kind of like talk to you guys about, is that when you have an arthritic dog, expand your mind. And I say to a lot of my owners, right, let's just imagine your dog's in front of us and we've got 10% pain here, we've got 20% over there, got about 30% here, the knees 50%, but we've got all of these other bits of pain, and we can start chipping away. So we can do a bit of acupuncture, we can do a bit of massage, and suddenly we've got a dog that is now only at 50% of the pain that they were. And that's before I've even touched the joint. So, yeah, there you go. So now let's talk about all the things that you can use to influence soft tissue.
Sure, yes. And just one little thing on fascia is that it's important for sensation and organizing, but it's also a big force distributor. And so again, if we have a problematic joint at whatever stage it is, if that fascia is all restricted, it's not doing its job of creating that array of impact, distribution. And so it might all just stick at one place. So we want the body to feel good. And I think that our trained focus on a joint might be, well, there's a lot of reasons, but if we're going to treat something with a drug, then okay, that can change the milieu of the joint, but physical problems often can use a physical solution. So physical medicine is what we're talking about. That's how you palpate it and you treat it. So there's not any drug that is going to alleviate these taut bands like we can with acupuncture and massage. I mean, so many of us have ropey bands that are coming from our head to our neck or in our shoulder. So many people have that right there on the trapezius, right there. I mean, that's what we're talking about. But imagine having to be on all four limbs here. And I think that that's where, when you feel at the behind the ears, so much of their off weighting is going to go to this lever arm here and start to cause tension there. And then they have neck pain. And that is a cause of suffering right there when they're moving like this and they can't change and rotate their position.
Can I tell them about my story that I put in there?
Sure. Yeah.
So this was for me very early in my career, and it was a bit mind-blowing. So this couple had brought in their black Labrador to be euthanized. They had decided quality of life was just not there anymore, and he was really suffering. And we'd explored different medical approaches, different pharmaceuticals. He'd been on a polypharmacy approach of, say, 3 different medications. And we're in the waiting room. It was quiet, and I put out the rug, and we were going to be there. And as I was talking to them about the process of euthanasia, the placement of the catheter, what happens, blah, 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 I was massaging this dog's neck because you do. Once you start using your hands, you can't not do it, is it? It's weird, isn't it? Once you break the seal, anything, you start massaging it whilst you're chatting. And the dog did this, stood up and walked out. And the owners were like, wait, he hasn't walked for 3 days. And I was like,
yeah,
must have had quite a lot of neck pain. And they went on and had easily 6 months, 12 months, but longer. And the dog's soft tissue pain had just got too much. And in my mind, we alleviated the discomfort. As you say, you can't do that with drugs. And the dog was like, thanks. Okay, I can get on with life again.
Oh, yeah. Right. And I mean, how hard it is for any of us to work if we have a lot of neck pain or a headache. I mean, it's just debilitating. And so historically, soft tissue problems have not gotten the legitimacy conferred on them by the medical profession like they deserve. And it wasn't until the mid-50s, with Janet Travell and trigger points, and she was President Kennedy's personal physician. And before that, doctors thought that people were making it up and malingerers. And she was the one that went in, was palpating, and found, no, there are characteristic changes in these soft tissue areas. And now we know so much more, but still it's under-taught and undertreated so much. And you think about it, I think with dogs on leashes with their collars, I mean, that kind of kills me sometimes. So it's not only once you know how to work with your hands that everything you want to just touch, but now if just going down the street, I say, okay, forelimb lameness, neck pain because they're walking like this. So the more that everybody is educated about even visual changes that go on, again, in part with the soft tissue and compensatory secondary changes like we've been talking about, but that leads to dogs or cats that have a head down, that they can't really move, side bend or rotate, but if they want to look to the right, then they'll move their whole body. You take a biscuit like this and they're going like this rather than turning their head because it hurts. So I think that, and then we can go on to treatment things, but just recognizing that if the animal doesn't want to do something, that they're not being obstinate, having an attitude, all these things. That is not what's happening. They are often in pain, and to force them to do things is not ethical or humane, and we more need to understand them.
And I think just talking about soft tissue and how it can be a really big source of pain, I think I'm still in the generation where for something to be serious, it has to be joint related or spine related or nerve related. That's like, oh, it's so painful, it must be to do with the spine. Oh, it's so painful, he's definitely fractured a bone. And you're like, recently, I have two of my male friends, so they're burly men, burly kite surfing men. And I'm like, both of them have got neck pain at the moment, and they both are like, I must have a trapped nerve. There's something seriously bad with my neck. And I'm like, probably not. It's probably muscle. And they've both been to see a physio, and they both come back going, I've got to do stretches.
Exactly. And yeah, I mean, I know Britain's healthcare system is different than the US, but there is more money to be made by recommending drugs and surgery than there is for people doing massage, but that can be another conversation sometime. But, that's where we have to educate each other and know that we have options and explore those options, as long as nothing's going to go wrong by delaying surgery, which is usually not a emergency thing to do, in most musculoskeletal things. But like you said, with your strong burly men friends, that it could be too with the dogs, that it doesn't take that much to incite a whole pain reaction over time. So it's like when your friends, maybe they had a sports injury or something, and then, okay, well, it kind of went away and they kept playing or living, or a dog had some kind of altercation and they had an injury. And so maybe it wasn't a problem at first, but the more that it goes untreated, it's like those pain impulses just it's like wearing a path in your nervous system that you can go faster and faster. So oftentimes it doesn't take very much to incite a whole big pain problem, because the nervous system has changed, which we call wind up, to just like send a whole pattern of problems. Sometimes even without an inciting factor, it can just kind of be spontaneous, or maybe you just moved a little bit wrong. So how to deal with that? Yeah, I usually start with acupuncture, because it has such strong research and multifaceted phenomena that it has benefits. And I had mentioned
just pause there a little bit, because I know a lot of people will go, acupuncture, no, there isn't anything. Well, actually, there's Cochrane reviews, which is the pinnacle of bringing evidence together, clinical trials, meta-analysis, bringing lots and lots of clinical trials together and go, seriously, does this work? For example, glucosamine is on the whole meta-analysis now. We've done many, many studies, and some studies have said yes, and some have said no. So overall, when you bring it all together, you're like, data's not too strong. Whereas with certain conditions, I think is it neck pain and migraines, they've definitely got a Cochrane review that acupuncture is beneficial. So there's certain areas in human health that acupuncture has been deemed very effective, and it is now recommended in the World Small Animal Veterinary Association pain treatment guidelines. So for a lot of people that go, no, it's all gobbledygoo, actually the tide is turning with acupuncture. There is a lot more evidence coming out.
Yeah, and there's reviews of studies for our conditions. I mean, and in human, a lot of work on knee osteoarthritis, relevant to our talk, but also low back pain and spinal cord injury. A lot of things. What we're up against as a challenge is that the idea that acupuncture is working by invisible energies and just all these metaphorical old kind of ways to describe things that aren't scientific, from pre-scientific times, hundreds or more years ago. But now in the modern era, we describe it as neuromodulation. So as I've said, to wind down the nervous system. So there are clear impacts on peripheral nerves, the spinal cord, and the brain. We can watch brain changes during acupuncture with functional magnetic resonance imaging, especially in humans, because they don't have to be sedated. So there's a lot of clarity about the nerve impacts of acupuncture and how good it is for nerve function, but also how it reduces pain and stiffness and tension in the muscles. And when we think, even if we want to talk about the joint itself, there are plenty of opiate receptors that will be stimulated by acupuncture. There are also endocannabinoid receptors, if we ever wanted to talk about cannabis. So yes, there's those changes, but there's also a lot of stuff that we can engage with, we can influence to help the health of that tissue. You bring in photomedicine, you're helping that cartilage not degrade so much. Maybe even you're helping rebuild some. We don't know. I mean, there's some evidence to support that. So there's such an array of things to do. It's so much fun to practice this way.
And I think when because I've been Western trained, I went to Cambridge, darling. And so I was at university for 6 years. Oh, by the way, I've got to do a big shout out. It's the International Vet Rehab Association.
Therapy.
Yes.
IAVRPT. We're sponsoring them too.
Are you? Yeah. Well,
yeah. Veterinary rehab and physical therapy.
So it's Cambridge this weekend. Well, Thursday, Friday, Saturday. I am doing a breakfast lecture.
Ooh, yay.
About how to educate owners about osteoarthritis. So, yes, just picking them up. I went to that university, very Western-based trained, and I've been going on my journey of learning and passing it on as I learn it to CAM followers. So I have a cynical side because of the Western training. Everything's got to be scientific. It's got to have evidence, etc. But it is absolutely fascinating, all of the different interventions that are available. But the rules I have in my head for everything, be it from drugs to acupuncture to massage, is that we need to be objective and we need to be making sure it works. And that applies to everything from a non-steroidal or monoclonal antibody to acupuncture and massage. You intend it to do something, and if it's not doing it, then you explore something else.
Right.
And there's definitely a rule that acupuncturists and massage therapists and body workers, and it's generally like 3 to 4 occasions. If there isn't any improvement seen, then that isn't working for that dog and we explore something else. Do you have the same kind of approach?
I mean, in general, and I'm glad you brought that up, because another difference between these treatments and a drug, and the challenge with research design is that it is really tough to have a placebo of acupuncture, that is fully inert, as we say, so doesn't produce any kind of stimulation. So the old drug model where you get a sugar pill or the real thing, I mean, that's what's informed so many research designs from then on, but that might not be really the model of research that will best suit these physical medicine approaches, where how could you do a placebo massage? I mean, and even laser has some challenges, because even small instances of that treatment will have neurophysiologic effects. But that doesn't mean we can't show that it works and show how it works. So,
yeah. And I think there is a tendency. I actually see this with medication, just going back to the rule of, is it working? I've had many owners that take away medication and they will come back at a later date. You say, so how effective was it? And they're like, oh, I don't know. I just assumed it worked because it's a pill, so it's going to work, isn't it? I'm like, no, mate, we got to check if it's working. So we need to be objective about this.
Right.
So yes, blah blah blah.
Yeah. So yeah, I generally say let's try 3 to 4 treatments of our multidisciplinary approach over 2 to 3 weeks, and then reassess. And we can identify certain goals at the outset. It's nice to take a video as we get started, because sometimes you forget how, just as we say, stoved up or whatever that animal was at the beginning. But usually, if you've done a myofascial palpation and you've identified areas of restriction in the back, in the neck, in the limbs, and you do acupuncture in the areas that are tight, you can feel that change during that one treatment. So that's just another challenge, is that there's not one type of acupuncture treatment for everybody. I mean, you've got your more Chinese medicine approach or your more scientific approach, and I say, let's design a treatment that is going to address the central nervous system, the peripheral nervous system, the autonomic nervous system, so the deal with the inflammatory state in general, and then the myofascia, so that we're hitting all the bases and treating the dog comprehensively. But you even inserting 1 or 2 acupuncture needles in a tight neck, you can start to feel that release, and you can see that animal change. So depending on your technique and your either the belief system or a scientific method, it will change the outcome of that treatment. So that's where not all acupuncture is going to be the same. Just like not all laser therapy is going to be the same. You have your different classes, different intensities, and also where you direct it. Not to just get it at one joint, but because it can relax a lot of tissue as well and improve blood flow, do all kinds of good things, tissue regeneration. And so I don't know, it's a call for science, and like you're saying, science and substance and rechecks, and the results should speak for themselves. It's not that hard to get animals to really show an improvement with physical medicine and integrative rehab.
So we've got a few questions. I'm not ignoring you guys. So
We're gabbing.
Them. Yeah, no, not. I want to do another little anecdotal story. And then I'm going to just say how a lot of OA cases could be managed. So when an owner goes into a vet's. So let's start with my little anecdotal story. So I used to work with a cardiac specialist, and everybody always thinks heart disease, oh my God, life critical. It's the most important thing to treat the heart. So a lot of energy would go on a very, very finite, diagnosis, and there'd be an array of medications. And quite often, dare I say, I think we can become a bit blinkered because we're so focused on heart disease. Oh my God, it's life-threatening. Oh my God. And I had been asked to look at a boxer who was on an array of heart medications and was really not doing very well. And behind the head, tension here. And the temporal muscles, so the muscles on the top of the head, were rippling, absolutely rippling. And I was like, I was really new. It was a bit of a wild card move. I was working with a cardiac person, and I was like, I'm just going to massage it.
Yeah.
It felt so much better. And then the heart meds were working really well. So we can become quite blinkered with conditions when comorbidity, having more than one condition, does exist. And that story just proves that what was really getting that dog down was muscle pain.
That's right.
And by addressing that and using the heart meds, the dog then got his quality of life back. So then on to my second point, just so people can see what we're trying to do. I'm still in first opinion practice, and I'm sure that most of you guys that are watching are owners, or you might be therapists or nurses. I've seen Witchy Nurse who's from St Austell, which is great. These are all people from Cornwall. Yes. So when I have a client come in, it's very first opinion work. I'm not in a referral centre, but my mind when I'm dealing with my arthritics is going, right, I need to look at pharmaceutical interventions. Are they appropriate? Is it one drug? Is it two drugs? Is it maybe three drugs? I need to be looking at weight. Is that appropriate? I'm looking at lifestyle. Is their lifestyle appropriate for the dog, or is it permanently causing triggers for acute flares? I then look at dietary. Is their diet appropriate? Can we modify that? I definitely am always bringing in the more integrative soft tissue approach. Now, is this going to be a massage case? Is this going to be an acupuncture case? Is this a laser case? What is this? What's the owner's journey? What's their belief system? But then also therapeutic exercises. I try and get all of my owners to have a little therapeutic exercise plan now. So I'm having all of these different areas, and that is truly multimodal. And that's what we should all be doing, is bringing in these different ways to manage this whole condition, because it's not just a disease of the joints. So yes, right, now we've got a few questions that there is this one, and I've been reading it whilst you've been talking. I'm trying to, so curious about the statement that these problems are not usually structural based, since OFA and especially the pen hip testing is so good at predicting problems even in very young dogs based on x-rays. I assume with that, yeah, absolutely. So these diagnostic tools are very, very useful for looking at dysplasias, so hip dysplasia, elbow dysplasia, and being able to diagnose structurally that that dog is likely, it's not definitely, likely to develop osteoarthritis. And with osteoarthritis comes the pain, the compensations. But you can have dogs that do have quite lax hips and they don't go on to develop severe arthritis because there's many other factors that come into play. It's a tool, it's not a definitive. Can you add to that, Narda?
Well, yeah, as you were talking before too, I was thinking about again that progression from normal and or as uninjured as you can be or whatever, just the early stages and then down lifestyle. And just how by what we do with dogs especially and train them, I think that there are some things that could be putting them more at risk for joint problems. So, for example, with an animal with hypermobility. So I tend to have hypermobility. That's my problem. That's why I need to have my muscles as toned as they can so that my knee doesn't slide around too much. And then that works. But I was thinking, now I know that a lot of dogs are taught like don't jump up. So and who wants to have a dog just push them over and with just being rowdy and everything? So it's culturally accepted to say, no, stay down. But what happens when they do jump up on something? Well, they're stretching their iliopsoas muscles, and they are also activating their gluteal muscles and their hamstrings. Those are all important in hip stabilization and stifle or knee support, especially when we're doing rehab and palpating for which muscles are active and which aren't so that we can design interventions to get those muscles firing. So often it's a problem where the gluteal muscles aren't firing well and the hamstrings aren't. And so we put them up on something or we have certain tasks to cause those muscles to fire. Of course, we have to check back in and are they actually firing? So it got me thinking, like, what other things do dogs naturally want to do? Like to jump up. Isn't it nice to just stretch? And when you can never stretch like that, or a cat that's been declawed and you can't just climb and hold on and do that there are consequences for their life. They are born, I would think, making some assumptions, but they want naturally to do that, and that is good for them. What other kinds of things should they be doing? Well, what about when you're taking a dog on a walk? Of course, I would never want to be led around by my neck. That would just be so bad, I would think. So I'm more in favor of harnesses that don't restrict the shoulders. But just seeing a dog want to smell something and jerking them away. Well, so much of their brain is about processing these olfactory stimuli, and that keeps them cognitively engaged and and they want that information. And so some people are talking about, well, take them on a smell walk so that they can kind of dilly-dally and get all that information that's important for their happiness. It's like checking their iPhone or something. What if we couldn't, get that information? Of course, there's addiction, but there are just important things that are intrinsic to the animal nature. Another thing, just to think about, let's say being in a house or an apartment or whatever, and what does the dog's walk consist of? Okay, we go down in the elevator, we walk out, it's all sidewalk, it's fairly level. Come on, don't smell that, don't keep stopping, bringing them back up the elevator. What's happened? Well, they haven't done any work to engage much of their core or their gluteals or their hamstrings, versus if they were in a terrain with different surfaces, different kind of textures that they're on. Maybe they go up a little hill or they go up and look at the squirrel in the tree, that they're actually using their body. That's the kind of thing that whether or not they are predisposed genetically or show up on a pen hip or whatever, that's the kind of thing that is going to maintain the structural integrity, because again, it's the nervous system that is changing the muscle firing and helping. Just, you want all this afferent and efferent, the coming and going impulses, so that the brain and spinal cord can coordinate muscle tension and stiffness as you're going to help protect the joint. So that's my little diatribe about, wanting to give animals more of a natural way of life and to really encourage full body movement.
Yeah, and I think that before we went live, we were talking about what message we wanted people to take home tonight, because we talked for an hour. What is it that we want people to take away from this? I think firstly, soft tissue can help diagnose the problem. So having your dog fully assessed, wouldn't it be amazing if in our lifetime, every dog, when they go for their vaccination, they also get a full body assessment, not just heart and teeth, but someone palpates over the whole dog, flex, extends, feels the soft tissue, and can say, do you know what? There's a lot of tension down that spine. There's something going on. Doesn't happen yet. It will happen, hopefully, in the next decade. So soft tissue can give you arrows pointing to where problems are beginning. And that is what Narda really wanted to get across today, is we are very reactive when it comes to OA management. We wait until it's there. And then we start trying to put the flames out in our building house, a burning house. And we're like, always on the back foot. But wouldn't it be amazing if both veterinarian, physical therapist, canine professional, and owner saw the merit of attention early? That would be incredible. So that's a big take home I think we wanted to get across, wasn't it?
It was, yeah. And I don't know if I could put a plug for this new organization we're developing. It's the Scientific Integrative Veterinary Medical Association, and it's really it's a worldwide endeavor to get veterinarians on our educational board and to spread the word and the information about the research and the value of integrative medicine and rehabilitation, just to people, so that they can advocate for their animal and ask about it and find solid information on with research and just studies that have been done, so that we're not waiting 10 years, because I don't want to wait 10 years. So we want.
I think I'm a realist.
Well, we want to change the paradigm, though. I think there's a critical mass of us now, and I just see a shift in veterinary medicine, and
definitely.
Part of it's with
huge.
So much going on. And we just had a course yesterday about horse rehab, and I was so stunned by the amount of research they're doing, just with changing, like dynamic mobilization of the neck, and doing studies on how, if there's a forelimb lameness, that changes back mechanics, and with just certain types of movement, they can strengthen the spine. So there's translational, so cross-species information that we can share that's just so clearly showing the value of just supporting the innate healing mechanisms, removing the blockages, and changing your lifestyle. It's lovely, and it should hopefully attract more people to veterinary medicine, because we need more.
Yeah, we've got a big vet shortage at the moment, but I think it is changing. I'm seeing huge drift towards the more and the proper use of the word holistic approach.
Right.
I think sadly that's been taken over, and it tends to be linked to wands and wizardry, and it's not. Holistic means treat the whole,
Right. And there should be a W in there, but whatever.
That's so true.
I wish it was a W. Anyway, we're not treating holes. Yeah.
Let's do it.
We do too, but anyway.
I love that.
Yeah.
Okay, so another take home we wanted people to walk away with is also consider treating the soft tissue. So use them as a diagnostic tool, but also when making your dog's management plan, because we can't cure this disease, but we can better manage it, and we can have a good quality of life for a very long time, is bring in the understanding that you're going to be also trying to treat the soft tissue. And Think of when I said to you 10% pain in the shoulder, 20% pain in the neck, 20% in its back, and 40% are at the hips. Yeah, so the hips are a problem, but we can chip away. Look at this. We can really improve this dog's quality of life. So take that away with you as well. A couple more questions. A bit of a curveball question. How do you manage soft tissue acute injuries, such as a paw or lower limb abrasion, laceration, when an animal has serious chronic OA in the associated joints? Carpal paw pad injury combined with elbow dysplasia. Are you kind of hinting that you've got two sources of pain in the same limb? Or are you saying I'm a bit confused with that one? Have you interpreted it differently, Narda?
I mean, it just might pose more challenges, either in terms of unweighting or just perpetuating the problem. But I would be treating all of it with a lot of laser, because laser is going to help with that tissue healing. It's going to help with the elbow.
Mm-hmm.
I don't know. I mean, it's the same thing. It all needs support, but I think you protect that area of the laceration and you treat it appropriately. But there are certainly ways we can accelerate that, and that's where photomedicine, so the use of light, that will accelerate that. And while you're at it, just treat everything else. So I don't see that as a problem too much.
No. I think, as you say, whether that person's struggling with trying to work out what's the biggest problem, is it the elbow pain or is it the wound that's causing the dog the biggest amount of discomfort? Well, treat both.
Treat both, and maybe there was a problem. What did one predispose the other? So once we do have, I mean, was there a problem with stepping? Was there a problem with avoiding an issue? I mean, things happen, but yes, whole animal treatment.
I work with horses, and when they have muscle issues, I use good old liniment. Have you used liniment?
Rarely, but I don't know where the world is outside of the U.S. with can I say cannabis, or will we get?
No, you can say.
Okay, all right. I think cannabinoids in salves are so needed for animal health, and then we can bypass some of that liver processing. I know I love either some CBD lotion, maybe. I mean, in Colorado, we're kind of cool with things, so we can get some THC in there too. I mean, it just makes so much.
Yes. Can you? Oh my God!
Cannabis. Anyways,
I didn't know Colorado was that chilled out about it all.
Well, there's still a federal issue, but Colorado is one of the first states, or the first state, to legalize. So it's a state-based thing. But we have so many dispensaries, organic, this and that. But why not deliver it to the area? I mean, especially with OA, and I know that we don't have fur, but just to get it, like I said, there are cannabinoid receptors in the joints. So why not put it there? And in a preparation that it wouldn't be the biggest deal in the world if the animal licked it off. Mm-hmm. So, and then some of the laser companies have actually experimented over time with some salves, and then to use laser on top of it to help drive that in. And so, you could do that as well. But
what's liniment? What is liniment? I don't know.
Well, just an external, thing you smear on the tissue.
Okay, cool. I know that I did when I started CAM, I spoke to some experts about why don't we have topicals?
Yeah.
Because we in humans will have ibuprofen gels, we'll have all of these deep heat gels and stuff like that we routinely use, and it was safety, because the animal will lick it off. Application is going to be difficult, the frequency of application, getting through the coat. So there was a lot of people that I spoke to just said that it's more trouble than it's going to be worth. But whether we go that direction over time, I'm not sure.
Oh yeah, no, we totally should.
So this one, the citations or Cochrane, I think you can just look online. If you type in Cochrane review and you type in acupuncture, you'll be able to find stuff. I haven't got them to hand, but it is all publicly available.
Yeah, I usually go to pubmed.gov. Maybe that's an American thing, but you should be able to find it. And then if you say acupuncture and systematic review, there are so many. So it doesn't have to just be Cochrane. It can be other well done reviews. Anyways, I know we're running out of time, so I won't.
No, it's cool. As well as videos and pictures, do you use anything else to assess from an owner's perspective? We have, and one of the ambassadors will hopefully put a link. We use something called the Suspicion of Chronic Pain PDF, and it's chronic pain in the middle, and there's a crisscross, and there's a circle above behavior change, and there's 3 lines where people can see, write down behavior changes, postural change, physical change, capability, and gait change. And it's a really useful tool for owners to distill down some of their thoughts, present it in a way that the vet can interpret it in this very restricted time that they have in the consult room. So you go in and you've got these things that are all happening at the same time. You're like, does this mean that I've got a pain related problem? And the vet's able to go, oh yes, it possibly so. You need to investigate it further. So that's useful. Do you know of any others? There's the validated tools.
Yeah, I mean, my soundbite is on sort of a how to see a dog thing. So observation. So the thing that I did for the big walk, the little video, and then we have a YouTube channel, Curacore, Curacore, and it might be Curacore Vet, not Curacore Vet, the car, but Curacore Vet, because we also have the med for the human. But anyway, I have a bunch. We have like 150 videos or something, and many of them are on these types of assessments. I have how to palpate a cat, like with myofascial work. It's number 2 of a 3-part series. So there's lots of things. If you just go to our channel, you can look around.
So Curacore Vet, YouTube. Yeah.
Yes.
Perfect. This is nice. I have to see you at the event then, Alicia, if you're going to be going. But it's so nice to hear that people use all the CAM materials, because I tell you what, the amount of work that goes in behind the scenes now, our overheads are around about 5 to 7 grand a month now. It's insane. Yeah. So we've got social media, we've got HR, we've got project manager, we've got a PA for me because my diary is terrible. There's a lot of work. So thank you for saying that you use it. The collars are scary for me too. Love sniff walks, doggy parkour. Yeah. Like Luna's never really on a lead, and I think that really, really helps. I'm always watching her posture and her movement and the slope of her back, and is she turning equally either side, because she's just off the lead the whole time. Yes, I totally love that. Oh, we've just got a sensory garden coming in at work. So my bosses gave me £1,000 budget to go and convert a part of the car park that's not being used into a sensory garden. So dogs, when they come to visit for consultations, they can lose themselves in this area. And there's all these different plants, different smells, different textures. There's wind chimes, there's mirrors, there's mounds, there's logs, and there's different height treat feeders, so that whilst the owner's waiting, they can keep their dog nice and calm. And I'm really excited. We're going to launch it soon.
Wow. And when the dog is calm, who else is calm? The person.
Exactly. So this one, my dog had a tumble twice in 2 weeks back in April. Orthopedic vet diagnosed possible injury to iliopsoas or possible hip dysplasia. No scans as yet, but been on short lead walks since then. Not getting anywhere, it seems. Thanks to CAM, we have been mindful of the multimodal approach and are managing weight better now. Getting mixed messages about whether massage laser therapy will help. Any advice? I think you're speaking to the wrong people. Of course it will help. Yes.
Right.
Yes. And definitely make sure you are working with somebody that's regulated and qualified. So we've got more information about regulation. I think we did a talk about it. There's some stuff on the CAM website. Go to Holly's Army and ask. So we have a number of physiotherapy degrees here in the UK, but then they all have to belong to a regulatory body. And that's really important. Make sure you're using somebody that's well qualified. And hip dysplasia, if there's any doubt, just get the x-rays done. Get some x-rays done so you know what you're dealing with. Thanks, Caroline. It's very good.
Thank you.
It's emergent. Sorry to repeat question, but maybe another. How do you deal with soft tissue injuries with an OA patient? It depends what the soft tissue injury is, really. Are you talking about muscle? Are you talking about tendon? Are you talking about ligament? I'm not. I know it sounds. I'm just a bit confused because I guess I'm just used to always treating the whole. That I don't really separate it from the OA. I just work around it. What about you, Narda?
Yeah, I guess I would want to know more about it, but it to me the arthritis is only a little place within the whole inflammatory, the whole patient, and so yeah, just like it's just a continuation, and we can think of like, why is this animal having that injury? But yeah, if there was muscle tension, there's muscle tension already in the osteoarthritic patient, and that's where I would like to challenge people. If you know you have pain, you have an osteoarthritic joint somewhere, where's your pain? Is it only in that joint? I would bet that a lot of your pain is coming from the soft tissue. So that's, especially if that's where your pain is. I mean, and it can refer to joints, it can refer away from joints. So you take that piece away and see where you are after that. And it's just like people that are maybe waiting for a knee replacement, and then they're sent to get prehab or massage or some kind of therapy or acupuncture. And it's like, oh, wait, I don't really feel like I need the surgery anymore.
Mm-hmm.
Happens so often. So so it's really, yeah, maybe the joint deformation can't change, but maybe the suffering is coming from more of something that can change a whole bunch.
And I think going back to like thinking about it as in tissue healing, you know, so the soft tissue injury, what is injured? What stage of the injury is it? Is it still acute? And you need to have more approach the soft tissue in, you know, as you say, laser, rest, that sort of thing? Or is it a chronic soft tissue injury and it's been there for a period of time? We're trying to kind of wind it up again to get it to start healing. It's a very broad question, but email me and we'll try and create a live about it. So hannah@k9arthritis.co.uk. Blah, blah, blah. Right, I'm gonna have to call it a day because we've been going for an hour and 6 minutes. I want to say a massive thank you to Narda for coming on tonight. It's always a pleasure.
I always enjoy it.
And I want to say a massive thank you to Narda for having the faith in CAM and sponsoring the Big Walk, which you guys need to know about. You need to support us. Anybody that listens to these lives, this is 10 quid, this walk, £10. It's nothing. 30 days of shed loads of information to help you support your dog, or it may be for you to support your owners. Maybe you're a therapist, a vet, a nurse. 10 quid, guys, nothing.
Do it.
We need you to sign up. If you're part of a vet practice, do a little walk. Do a sponsored event. It might be, so for the month of September, I am going to swim every day with my dog in the sea. For 30 days, go do it every day to raise money for CAM. Think of something that you might want to do. Maybe you're going to be on your social media. You're going to do a post about arthritis and give a piece of information away every single day for 30 days. That could be what people sponsor you. So think outside the box, guys, and support the Big Walk. I'm sure that Laura will put another link. And thank you to Curacore for being our gold sponsor. Right, on that note, I'm going to say farewell to the pips. We're going to see you on Thursday from Cambridge, darling.
Yay.
Me and Evie will be interviewing Dr. Katrin Jan about pain and behaviour. So hopefully see you all there. Until then, thank you, Narda. Very grateful. And I will speak to you again soon.
Okay. Take care. Thanks, everybody.
Bye-bye.
Bye-bye.